Hello and welcome. You're watching Coronavirus Facts versus Myths, the show that gets you all the latest news on COVID and on vaccines. First up, let's take a look at India numbers. And India reported 37,593 new cases in the last 24 hours and as well as 648 deaths. Now, that's an increase in the number of deaths, but that is because Maharashtra reported some death numbers, a backlog of death numbers that got added into the final tally, and that has led to a high number of deaths being reported in the last 24 hours. So even the cases, if we talk about, it's an increase of 47.6% from the earlier figure, which was 25,467. From Kerala, 24,296 new cases were reported, and it continues to lead the states in daily COVID cases. The state also reported 173 deaths, the most deaths by any state after Maharashtra, which reported 288 deaths. Let's take a look at the vaccination equation. And if we take a look at the numbers who were vaccinated, it's 6.4 million were vaccinated on the 24th of August, and the weekly average over the last 7 days is 4.7 million. But that continues to be below the rate that we need to be vaccinating. It needs to be 1 crore a day at 10.9 million a day if we're to vaccinate 60% of the population by the end of the year, by December, which is what the government has said. At current vaccinations rate, we'll only be able to vaccinate 31% of the population by the end of the year, by December. Now, a special focus on the show, a COVID patient in Chennai whose lungs were fully damaged recovered after being on ECMO support or artificial lungs for 62 days. He is being touted as India's longest surviving patient on ECMO without transplantation. This was at Chennai's Rela Hospital. It was a new lease of life for 56-year-old Mohamed Muddhija. His lungs suffered total damage after he had tested positive for COVID in April end. Doctors had put him on ECMO after the condition of his lungs deteriorated, but later he improved and could be sent home. We'll just bring up those visuals of when he went home, and last week he left the hospital after being on ventilator for 109 days. Well, joining us now, we have Mohamed Muddhija joining us on the program. Thank you so much for joining us on the show. And you're being called, it's being called a miracle, the fact that, you were in hospital for 109 days on ventilator and finally could step out. If you could tell us how you are now, and or your daughter could tell us how you are now.
No, thank you very much. Ma'am, the voice is not that much clear. My daughter will say.
Yeah, now I think he's all right. And yeah, we are very happy to have him back home. And I would like to thank Rela nurses, doctors, and everyone who helped us. And yeah, first of all, God, who helped us. And I feel we are very lucky to have our dad back home.
No, I can absolutely imagine, and what the family went through that whole time of the second wave of COVID was very frightening for so many. And I believe your mother was very strong throughout, the time of your father's illness. And if you could just, take us through that, and the fact that, he was on the ECMO machine for so many days.
Yeah, it was a long period on ECMO, and at a point we lost hope that doctor suggested as lung transplantation, and we had even registered for getting a donor. But he is a very brisk person. We didn't want him to sit very idle. So we were very strong that ECMO is the one which would cure my father.
No, absolutely incredible. I also believe, that he's a bit of an athlete, that he was, quite sporting or good, into fitness, and he feels that is something that helped him.
Sorry?
That your father was very active and very, into fitness, and that's something that helped him?
Yeah, he used to go for 15 to 20 kilometers walking each day. And after he wakes up, his first work is to do exercise. And he never misses exercise.
And what is it like now? Obviously, you still have to continue being very careful for the moment till he can get his, complete health and strength back.
Yeah, I think he recovers completely in a month and is able to get back into his work.
All right. We're also joined by Dr. Aishwarya, consultant pulmonology from the Rela Hospital, Chennai. Thank you so much, doctor, for joining us. And we were just speaking to Mr. Mohamed Muddhija and his daughter there. But doctor, if you could just take us through, what this entire, treatment was like, the fact that he was one of the longest patients who've been the longest on ECMO, and now he's got back, the use of his lungs.
Yeah, first of all, thank you for joining me. I'm so sorry. Professor Rela sir was supposed to join, and sir is in the middle of a surgery, so I'm talking on his behalf. I'm Dr. Aishwarya, I'm a consultant pulmonologist at Rela Hospital. So the journey of patient Mr. Muddhija, before even I start, I would like to say one thing. He is in front of us all fit and safe is only because he was confident all through the journey. He was beyond us. He definitely had the confidence that he's going to go home. Because even in the darkest days where he had to go through a lot of pain, he always had the smile on his face, and that used to give us a confidence that he's going to go home someday. So the journey of patient Muddhija was, he came to us almost on the 1st of May, wherein he was tested positive in, I think, the last week of April, and he came to us with breathing difficulty. So when he came to us, he presented with breathing difficulty, and we had to put him almost on 15 liters of oxygen. And the following couple of days, he started deteriorating in spite of all the antivirals and medications that we gave, and we had to put him on a ventilator. After putting him on ventilator, we gave him a trial of, this upside down ventilation and everything, and nothing really worked. That's when we thought that we would give him a ECMO support. So we put him on an ECMO support, and he was on ECMO support for 4 weeks. And by ECMO guidelines, if a lung does not really improve in 4 weeks, generally the prognosis is not that great. So we also gave them an option of bilateral lung transplantation, and he was registered in the lung transplant registry. But because of COVID situation, we did not have much of organ donation. So we continued to put him on ECMO. And almost about 8 weeks, actually, he started showing some improvement, which is very, very rare, because by 8 weeks showing an improvement, the cases are very rare. And the patients can show improvement on 8 weeks. The only thing is holding the patient on ventilator and ECMO on 8 weeks is actually a huge challenge, because we did face a lot of challenges in terms of infections. He started developing pneumothorax, there is a leak in the lung. So mainly the infection was the greatest challenge that we had to face. And so by 8th week, he definitely started showing improvement. And by 8 weeks after this improvement process, the family also withdrew from transplant decision. So they wanted to continue on ECMO, which worked for them as well as for us. So he started improving, and by 60 days, he was completely, we were able to see him be on and off ECMO, and by 62nd day, we took him off ECMO. And then from there, another 15 days, he was on ventilator, and he's been off it. So this is a huge journey. I mean, the confidence of the family and everybody. So the journey was not easy for us as well as for the patient. I'm sure for the family as well. He had a very supporting family. His wife was all through to a very confident lady, and the kids were also very supportive. So, and as such, patient Muddhija, he had this, a strong, he was working out, and he's a patient who was going to walking almost an hour a day. But as we know that COVID did affect people who were young in the second wave. So he was also no exceptions, but then he had to go through all this process, and today he's completely fine. This 2 liters of oxygen is an on and off that we give him for exertion while he talks. I think his voice is also a bit muffled now because we had just closed the tracheostomy for him. It's been a week. Otherwise, he's perfectly fine. He's going to come to us tomorrow for actually a follow-up.
Is also there, and I believe she also played a big role. As you said, the family never lost, any hope, and they were very strongly behind him. And he also thinks that it's his fitness in the past that has helped him through this period. Dr. Aishwarya, but if we talk about ECMO, it's really out of reach for most people in India. It costs something near 40 lakhs a month, and that is really expensive and something that not everybody can aspire to. If we want to give hope to people, in this sort of situation, what would you say on that? Are efforts being made to ensure it can be given to more people or provided to more people?
See, I accept the ECMO is definitely a very expensive procedure, because it involves a lot of care, because it's completely a one-on-one care. When it comes to ventilator, again, it's a one-on-one care. But then for ECMO, you again need to put another person as perfusionist who is going to look for clots in the ECMO. And we need to keep changing the oxygenators. A lot of infection control has to be a part of it. So yes, it involves a lot of money. And I accept a lot of people cannot afford for an ECMO support, but not a large group of population can also be put on ECMOs. For example, we need to work a patient who is on ventilator to be going through ECMO. So the population that goes into ECMO itself is actually very small. I'm sure the government can also, help in helping this very small population. I mean, there are not many ECMO machines as such in India. So what we saw in this pandemic was definitely helping in terms of patients who were going into ventilator when put on ECMO if they are into ventilator for a couple of days and then immediately put on ECMO. And early ECMO definitely did help in a lot of patients. So
right. And
yes,
also this organ transplant, that's another big issue in India, that we don't have enough people who are organ donors, isn't it?
Yes, definitely. That's a big challenge in India. I mean, especially during the pandemic, we faced a huge challenge. Even now, so many patients, post-COVID, we have a lot of patients registered for transplant, waiting for organs. So we request actually people should come forward and donate. A lot of families do not even, even after a good amount of counseling, they don't want to really do. I don't understand. It's been like that in India for a long time. So I think that should change.
All right. And Mr. Muddhija, is there something that you would like to add or your family would like to add?
Aishwarya ma'am, our Mukam doctor and Kamalakalan sir helped us a lot through this journey. And as ma'am said, lung transplantation, we were not very sure that will it be successful, because that was a 50-50 chance. And we didn't want to take risk in case of my father. So I thought, okay, let's see on ECMO.
Right, and that was a risk. I believe the family didn't want to actually go in for that transplant because of the risks involved there, Dr. Aishwarya, and that was something that they chose to do.
Yeah, I mean, they already were going through a very extensive process, and for them, transplant looked even far for that. So I think they wanted to go through just ECMO and not go in for transplant. We can totally understand that.
Well, that's an incredible story there. Somebody who spent over 60 days on ECMO, that's artificial lungs, finally recovering use of his lungs and going home to his family, as you just saw there. Well, with that, time for us to slip into a short break. We'll get you more on the other side. Stay with us. Welcome back. Now, the chief scientist of the World Health Organization, Dr. Soumya Swaminathan, has said that COVID in India may be entering some kind of a stage of endemicity where there is low or moderate level of transmission going on. The endemic stage is when the population learns to live with the virus. Well, to talk more about this, we're now joined by Dr. Arvinder Singh Soin, Chairman, Institute of Liver Transplantation and Regenerative Medicine, Medanta. Thank you so much, Doctor, for joining us. So this sounds like good news. Dr. Swaminathan saying India may be entering this endemic stage. If you could explain that to us.
It's a mixed bag. Endemicity means that we have to live with the virus. It also means that we may be susceptible to severe infection and death, like it happened in the second wave. So we have to find good treatments for this. For example, malaria, tuberculosis, chickenpox, these are all endemic. They all happen with predictable frequency in a defined population like India. So that's what endemicity means, that we have to live with the virus. We have to find better treatments so that people don't get hospitalized and people don't die. Also, we have to get vaccinated for sure. And perhaps every year, new vaccines will need to be developed, or the older ones need to be tweaked and updated to be effective against the new variants.
All right. So just like we have the influenza that comes every year and affects us. So, but the worry also is that India's vaccination levels are very low right now. If we talk about, compared to the rest of the world, some of the countries, of course, there's some countries that haven't got vaccines. 9.4% of our population has received both doses, and that remains quite low. And especially now what we're seeing happening in the United States and even in Israel, where they've got high rates of vaccination, the COVID cases are rising.
So yes, countries that have got better vaccination rates are seeing new surges of COVID infection. But mind you, deaths are largely among the unvaccinated or people who have comorbidity or the elderly. So there are these three kind of susceptible groups, and those are the ones that we need to protect. But it goes without saying that vaccination is better than no vaccination. So you can't just live in the hope that you will get herd immunity or some kind of protection just by getting natural infection, because that can be devastating, as we saw in the second wave. We do have to get vaccinated. But even after vaccination, there will be some infections, but usually not severe or fatal.
All right, Dr. Soin, will do stay on for our next segment as well, where we're talking about vaccines. Now for our special campaign, Vaccinate India, in partnership with Google, where we talk about many questions that you have about vaccines, about COVID questions that you often Google. Dr. Soin with us to take those questions. And one of the questions that people are looking up a lot, especially when, there's so much talk of vaccines and getting more vaccines in our kitty here in India, is how do the mRNA vaccines work?
Gargi, all vaccines work pretty much the same way, in the sense that eventually they result in production of the marker on the spike protein of the virus, which the body recognizes and produces antibodies against. So mRNA vaccines work in the way that they will result in the manufacture of that protein marker in the body through the cycle mRNA, DNA, protein, and protein marker, and then the body produces antibodies against that.
All right, because, the Moderna and Pfizer, the mRNA vaccines, they're said to have higher efficacy, and that's been, something that people have really focused on. And though even anything above, 60-70%, all the experts say is good enough for vaccines.
So, the efficacy is, again, a complicated issue, because a lot of these vaccines were tested in the earlier part of the pandemic when the standard Wuhan variant was there, and majority of them haven't been tested in the peak of Delta wave infection. But there are some vaccines that have been tested in that peak as well. Also, when these were devised or made in the lab, they were all against the standard strain, not the Delta variant or the Delta plus variant. So you can't really compare efficacies of two vaccines manufactured or tested at different time periods. But in general, any vaccine which has more than 70% efficacy and protects against severe infection or death is good.
All right. Another question that people often look up now is how long does it take to develop immunity after receiving the vaccine?
So that's a pretty straightforward answer. It takes 2 weeks after the second dose of the 2-dose vaccine schedules to develop good immunity.
Right, and a more difficult question, I suppose, would be how long does it take for that immunity to wane? Because that is something that everybody's, talking about right now. As we said earlier, that in Israel, they're even having booster shots, in the US as well. So this is something, of course, in India right now, the focus is to get everybody vaccinated. But immunity erosion is also an issue that we need to know more about.
So it is generally thought that in people who do not have a comorbidity and who are younger than 65, they will typically have the protective antibodies or protective effect for anywhere from 8 to 12 months. That's the current thinking. But people who are elderly, who have comorbidity, or who are on immunosuppressive medications, like people who have had transplants, liver, kidney, bone marrow transplants, these people may lose their protective value of the vaccination earlier.
So it's important that the more vulnerable get those booster shots sooner than later, isn't it?
Absolutely.
And doctor, a lot of people have started, measuring their immunity in a sense by going in for antibody tests to see, how much COVID antibodies they have. What would you say about that?
The science behind it is not complete. There are a lot of antibody tests available out there. Not all of them actually depict or show the protective value or so-called neutralizing antibody value. And also there's no, if you have a value of 100 and I have a value of 50, maybe you could get an infection and I may not get an infection. The other thing is that it also depends on something called T-cell protection, and that cannot be measured by routine tests in the lab. But having said all that, with all these caveats, everybody would like to know their antibody level, especially the protective antibody level against the spike protein. And in general, if you have good levels, you are more likely to be protected.
All right, that's good to know. Well, thank you so much, Doctor, for joining us on the program.